So how to diagnose tuberculoma and neurocysticercosis? Sometimes it becomes difficult in clinical situation that tuberculoma and neurocysticercosis, especially on the imaging findings like CT, brain and MRI, looks more or less similar and there is a diagnostic confusion. So in that situation, we will discuss a little bit how to diagnose confidently that tuberculoma and neurocysticercosis. So first we should understand that how does uh, brain tuberculosis develop. If you see that there is a primary focus in the lungs, that is microbial tuberculosis, that goes in a systemic circulation reaching to the lungs. Second is seeding, causing development of tuberculoma or CNS tuberculosis. So to remember that lung is a focus in 80% cases. So if we do a X-ray in that patient, X-ray is, there is high chance that we can get an abnormal X-ray in the form of lesion that could be active or healed also. So we can get abnormal X-ray in most cases in case of CNS tuberculosis. Alright, because we know that there is a first lungs are affected, then there is a dissemination of that bacteria to the brain causing CNS tuberculosis or tuberculoma. Alright, so this is just a brief of how does CNS TB develop. Now coming to imaging features of tuberculoma versus neurocysticercosis. So this is very important and sometimes confusing also. So we will discuss the most specific things here. So on CCT, if we look appearance of tuberculoma, size is more than 2 centimeter, irregular, thick outline, and there is a marked pre-lesion edema. This is very important to know. There is a lesion edema is very intense around the lesion. Okay. However, in the NCC, it is size are less than 2 centimeter, regular, thin, rounded outline with variable edema. Location is very important. In tuberculoma, it is located mainly infratentorial or it can be supratentorial also, but most commonly lesions are infratentorial. However, neurocysticercosis predominantly supratentorial. Midline shift is very common, more likely in case of tuberculoma. However, neurocysticercosis it is less likely. Alright, if you do a contrast MRI, appearance will be on T2 imaging. It will be have a hypointense score in case of tuberculoma and hyperintense score in case of neurocysticercosis having eccentric dot. And scolex are best seen in case of neurocysticercosis sometime. And if you see the scolex, they are highly sensitive for neurocysticercosis. Alright. And if you do a MRS spectroscopy, lipid peak will be present in case of tuberculoma. However, lipid peak will be absent. So lipid peak is classically seen in case of tuberculoma because there is a damaged cells that reach cellular content and lipid causing lipid peak. Okay, and relaxation time will be shorter in case of tuberculoma and longer in case of neurocysticercosis. Now, so here is just to revise, the lesion are infratentorial most commonly in case of tuberculoma. However, lesions are most commonly supratentorial in case of neurocysticercosis. If you see lesions, supratentorial most commonly and infratentorial in case of tuberculoma. This is little bit about your lipid core, lipid peak, and lipid peak is classically seen in case of tuberculoma and it is absent in case of neurocysticercosis. So this is how we diagnose. But most important part is if we know that how does CNS TB develop, then we can able to understand. Okay. First is clinical history. Means here will be fever, low grade, weight loss, and maybe dry cough. Usually subacute to chronic presentation. Alright. One important point is history of contact. That is very important. Sometimes the patient have history of contact of TB in family. All right. And third, if you do a workup, chest X-ray, we can get abnormal and active or old healed lesion can be present. All right, because we have seen that the lesion in the X-ray that disseminate in the brain to cause CNS tuberculosis. All right, and also you can do USG abdomen, and where we can find necrotic lymph nodes that will be highly suggestive of tubercular lesion. Another important test we can do here is your Mantoux test. And that can be positive also, and it will suggest TB diagnosis. So this is how we can confidently make a diagnosis of tuberculosis versus neurocysticercosis.